And from Halloween to dental care, I'm sure my next guests have some advice about brushing teeth after all that candy. Of course, you already know that. So today, we're talking about orthodontic care, and more grown-ups are looking to have their teeth straightened. And maybe they never had braces as a kid, or maybe their teeth have moved as they aged. Whatever the reason, there are plenty of options that don't involve a mouthful of metal. And I'm joined once again by Doctors Beth Love and Richard Berry with Lifetime Dental Health. Welcome back to both of you.
Glad to be here.
I know that advice is brush your teeth after all the candy, right? Absolutely. Let's talk about this field of dentistry and how it's changing, Dr. Berry, especially for adults. You talk about braces in terms of orthodontics. What do you mean by these new terms that you're using now?
Well, right now we like to use different methods of orthodontics, not the traditional method where you have the brackets and the braces and the metal mouth. We have two different kinds of methods that we can use. We can use Invisalign, which is clear retainers to use, and we also have some braces that are tooth colored that don't show.
Are these braces, again, full mouth like we used to know, like we're familiar with?
They are, but you know, like I said, when they're clear, or not clear, but tooth colored, you don't see them at all.
Mm-hmm. You have something, Dr. Love, that you call the social six teeth. What do you mean by that, and how does that apply to orthodontics?
Well, what we do for adults is called short-term orthodontics, and short-term orthodontics are, it takes about 4 to 9 months to complete, but generally under a year for most cases. The objective is just to move your anterior teeth and that are crooked or crowded or have spaces. And we take that from a smile that's unattractive to a very attractive smile. We don't actually correct your bite so much, but we focus on the teeth that you see when you're smiling broadly.
That's what you're talking about, those social six,
social
right?
six.
Yeah, that's it.
Those are the social six, and we take those anterior teeth and we transform them from that smile that you're ashamed of into that smile that you can smile confidently with. So that's the social six that we're talking about, and we focus on that.
And there are new ways now, I know, to achieve those results. So Dr. Berry, one is Invisalign. How would you explain that procedure?
Well, the Invisalign is actually a series of clear removable trays or retainers that you wear for 2 weeks. There's a picture of them there. And after 2 weeks, you remove them and you place the next set in a series. And depending on the amount of correction determines the number of trays that you need, and it usually takes 10 to 30 trays to accomplish.
And how long would this be, 6 months, a year?
Well, if you wear them every 2 weeks, if it's 20 trays, that means 40 weeks.
And do they wear this all day long, when they sleep, except when they eat?
Yeah, the nice thing about the Invisalign is that the patient can take them out to brush their teeth, they can take it out to eat, but for compliance sake, you have to wear them about 20 to 22 hours a day.
So if you want to take them off for a special occasion, you can.
You sure
but
can.
the longer you wear them, the faster it goes.
You got that right.
You got it.
And
Okay, Dr. Love, there's another one now called the 6-month smile. Well, how is this different than Invisalign?
Well, 6-month smile is actually a more popular, it's becoming more and more popular with our adult patients. It does have brackets and wires, but the beauty of 6-month smile is that these brackets and wires, we do have a picture up there of an adult wearing the 6-month smile. The beauty of it is that the brackets and wires are tooth colored. They're inconspicuous compared to those metal mouth braces that we had when we were a child.
Right.
So, we move teeth with a special titanium wire that has memory in it. This efficiently and gently moves the teeth into the proper position. Dr. Berry and I like this 6-month smile because we have more control over this tooth movement as compared with the Invisalign. This decreases the treatment time, and we can generally complete cases within a 4 to a 9-month period, the average being 6 months, hence
6-month smile. And you can do this right in your office.
Absolutely.
We do it every day.
Because people think, Dr. Berry, they have to go to an orthodontic office to get this type of work done.
they don't. We specialize in this area.
We have some before and after pictures, and that's one of those things that really, if you are questioning whether or not it's worth it for you as an adult, and I know, Dr. Love, there are more adults now that are much more conscious of their smile, and they're doing this, aren't they?
They are. Our more perfect patients for these short-term orthodontics are our patients that have relapsed since their childhood orthodontics, or, as you said, mentioned earlier, the adult patient that has wanted to have braces, but they put their kids through it, but now it's their time,
Yes.
and they just don't want to go.
Dr. Berry's like, yes.
Right.
You know what? It doesn't doesn't matter the age, does it, Dr. Berry? I mean, we all deserve
We
this
can
for
do
ourselves.
it up to age 70 or 80. Whoever wants it, they can have it done.
Great results. It's nice to see both of you. Thank you.
Great
Thank
to
you
see you,
so
Gail.
much.